There have been a lot of changes to the diagnosis of autism. The most major change was the combination of a lot of different disorders that are now falling under the umbrella of autism spectrum disorder. Rett's disorder was considered a genetic condition that was very rare and often resulted in a child having a really big head and having deficits in socialization. Autistic disorder was seen as a very severe presentation of autism, nonverbal skills as well as low IQ or presumed low IQ, and those were often the category for autistic disorder. Asperger's syndrome actually was the official name, was a perceived more mild presentation of autism. The criteria for autistic disorder was exactly the same, with the only difference being individuals with Asperger syndrome had no language delay. So I would like to take a quick moment to kind of clear up some misconceptions about Asperger's in particular. A lot of celebrities or public figures have publicly come out and stated they had Asperger's syndrome, and they're often very prominent in their field. You know, individuals with autism spectrum disorder, just like individuals with Asperger's, sometimes they have highly fixated interest and perseverations, and when put to good use and they really want to expand their knowledge in something. So even though the disorder Asperger's syndrome doesn't exist anymore, those types of people are still captured under the autism spectrum disorder umbrella. Truly, autism is a spectrum disorder. So we moved from a severe, high to low functioning sort of dichotomy to more of a leveling system. So the levels are level 1, 2, and 3, and we rate the severity of the social, emotional, reciprocity issues and the restrictive repetitive behaviors. In addition to those specifiers, we also have to indicate the presence of a language impairment and a presence of an intellectual impairment. With that being said, we get really sort of specific with the autism diagnosis, which really helps communicate to families what sort of to expect. And for practitioners, when we have those leveling systems, we can more accurately predict treatment packages, as well as be able to know the intensity of treatment that needs to occur. So it really gives clinicians the ability to clearly identify the current strengths as well as the current deficits in an individual, where it really helps to tailor treatment to your child's actual needs.